And can you
Yes.
hear me? Okay.
Yes, ma'am.
Thank you very much. So as Siddiqa has already mentioned, it would be really nice if you all can mute your mics while the lecture is going on. And I'm happy to answer any questions, but in the best interest of time and in the best interest of keeping the continuity, if the questions can be kept towards the end, you can send it in the chat, or towards the end you can unmute your mic and ask the questions as well. So today I'm going to talk primarily about hepatitis viruses, and as you know, sorry, I'll just need to introduce myself. I forgot that. I'm Dr. Iram Khan. I'm a professor in microbiology at the Department of Pathology and Laboratory Medicine at Aga Khan University. As a microbiologist, both bacteriology, virology, mycology is the area of interest, but virology is my expertise. So here we go with the topic, that is the viral hepatitis. This is not moving. Just hold, please. I think this is pitched down. Okay. All right, so these are the learning objectives that we will be discussing. By and large, we will be defining what hepatitis is, what are the different types of hepatitis, and of course, you know, the different viruses that can lead to hepatitis. So these could be specific hepatitis causing viruses, but then there are certain other etiological agents as well that can cause viral hepatitis here. So we will discuss about infectious, non-infectious causes of hepatitis as well. And then we will discuss in more detail hepatitis B, D, and C, because these are the viruses that need more detailed discussion, while A and E, you will see that they are much more simpler to understand, and I believe you can read it and get through it at your own. The scope of the disease, signs, symptoms, risk factors, and interpretation of lab diagnostics. These are the main areas that you need to know at part 1 level for both B, D, and C more specifically. All right, so we start with what is hepatitis, and I'm pretty sure you guys know what hepatitis is. You can type it in your chat boxes, your responses, and I will see how you respond to it. So what is hepatitis? Anyone, just put it onto your chat box. So primarily, the term hepatitis, as you all can see, the word hepa means liver, and itis means that it is inflammation. Very good. Yes, you all are right. It is inflammation of liver. Now, this inflammation could be because of viral causes or could be because of non-infectious causes as well. Okay. Now, what it means that specific viruses, when they inflame the liver becomes far more rugged and swollen. So if you see on your left-hand side, the liver outline of a healthy liver, which looks very clear, glistening, and intact, whereas when the liver gets infected by the viruses, it becomes over a period of time, that is, as the chronicity goes on, there is a scarring, there is a lot of a lot of scarring, which leads to loss of glistening effect of the normal healthy liver. So the liver surface appearance appears more rugged. And then in certain patients, it may also lead to development of hepatoma, which appears like a mass within the liver. Now, you can see that the causes of inflammation could be infectious and non-infectious. Among the non-infectious, most common causes are drugs, toxins, and of course alcohol. All these will produce similar findings in the liver, just like infections. Okay, so that is why it is important to rule out both infectious and non-infectious causes of the liver. Within the specific viral hepatitis causing viruses, you have this number A, B, C, D, and E, which there are found many others as well, but from the medical point of view and from more important point of view, these are the ones which are more commonly applicable, and we will be discussing them. However, other viruses, for example, CMV virus, EBV virus infection, dengue virus infection, they all can cause hepatitis. So it is not just that the hepatitis viruses will cause hepatitis, but then there are other viruses. So you have to rule out those viruses as well. Certain parasites, as you all know, for example, amoeba, entamoeba histolytica can also cause hepatitis inflammation leading to hepatic involvement. Bacterial infections can cause that. And then, of course, physical damage, trauma can also lead to inflammation of hepatic liver cells. Right. So now focusing primarily on the hepatitis causing viruses. As I mentioned, these are 5 hepatitis viruses of medical importance that we will be discussing here, A, 2, D, and E. What you are expected to know, what are the sources of these viruses, how they are transmitted, whether they lead to chronicity or not, and whether there is any preventive effect that is available. So here you can see for A and E, there is a lot of similarity. For A and E, there is a lot of similarity within them, that they are both transmitted by fecal oral route, and there is no chronicity, so they are acute infections. And in case of hepatitis A, we do have pre and post exposure prophylaxis available in form of immunization and immunoglobulin. But as unfortunately for E, the difference is that we do not have vaccination available. However, by ensuring safe drinking water, you can prevent this disease to a large extent. In case of B, C, and D, these are far more have most of their effects, similarity in their effects, that 3 of them are blood and body fluid based transmission, that is their source, and route of transmission is primarily percutaneous or permucosal. So either they are during the transfusion reactions or during the use of sharp injuries. All 3 of them can lead to chronicity, and primarily in case of these 2, the hepatitis B is the only one where you have immunization available, but unfortunately for C and D, the only preventive measure is to do proper screening. Okay? So, all right, I hope this is clear so far. So just a quick catch up, 5 types. A is orofecal, and so is E. And of these, only these 2 have, A and B have the vaccination available for prevention. Now we move on to the specific viruses. Hepatitis B to start off. Hepatitis B virus, this is what is shown here, is the electron micrograph of hepatitis B virus. You can see elongated materials and the rounded bodies as well. The rounded bodies are the Dane particles, the virus, intact virus, complete virus in itself. It is a DNA virus, virus, has a circular nucleus in it. And then you can see a lot of irregularly shaped elongated structures. These are the B surface antigen, which is the extra antigen which is released into the circulation at the time of active virus replication. Hepatitis B virus, you all know, it is the most common cause of hepatitis. Up to about 400 million people throughout the world are infected, and this is about highest involvement in part of the hepatocellular carcinoma. 15 to 40% of hepatocellular carcinoma are because of hepatitis B. In Pakistan, the exact surveillance is not known, but the prevalence rate is considered to be somewhere between 3 to 4%. Here you can see the distribution. This is the WHO released map for hepatitis B virus, and Pakistan falls in intermediate zone, which is 2 to 7%. So this is the range we may be falling into. All right, so within the geographical prevalence of hepatitis B, you can see that the low prevalence, that is less than 2% in North America and Western European countries, primarily the burden is in early adulthood. And this is primarily because of the sexual and percutaneous transmission due to use of drugs, IV drug abuse, and use of contaminated needles. But in cases where there is a moderate risk, like in Pakistan, 2 to 8%, it has been implicated that childhood disease is far more common. And this is occurring because of the horizontal transmission from mother to child. And therefore, screening, perinatal screening, and at time of antenatal screenings is very, very important to bring this under control. And same goes for the high burden countries as well. Transmission, you can all, I'm pretty sure you all know, blood and body fluids are the primary route of transmission. In addition, sexual transmission, vertical, as we meant, already discussed, from mother to child. If the mother is infected, then the transmission is bound to happen. Use of unsafe injection, especially in IV drug users or in low-income countries where the implementation of the safe use of injection is not very robust. More importantly nowadays is hemodialysis. If the people who need hemodialysis, and if they are not offered a dedicated hemodialysis, if the same hemodialysis machine is being used for both infected and non-infected people, then this could be source of infection. Nosocomial transmission, as you all know, if you as a healthcare worker, if you are not vaccinated, then you have a high risk, especially if you are dealing with the blood and body fluid of the patient. Okay, having talked about the body fluids, what are the risks within the fluid itself? Which fluid has the highest and which has the lowest? So as you can already predict, blood, serum, and wound exudate pose the highest risk, whereas the sexual secretions like semen, vaginal fluids, and salivary secretions, they have a moderate risk. So there is a virus secretion, but there is a moderate risk here. Very low risk in case of feces, urine, sweat, and breast milk. So this is not a very active source of transmission. However, these two are more active source of transmission. Okay, now moving on to the clinical types of the hepatitis. I'm sure you all have known these terminologies as to acute hepatitis versus chronic hepatitis. Can anyone quickly put it into chat? What is the cutoff where you will say acute, differentiate acute from chronic without looking at the slide? And I will give you 3 seconds. Okay. No response in the chat so far. All right, so as you can already see, that yes, acute is short term. Yes, less than 6 months. That's correct. I guess you all have read it now by now. So acute hepatitis means any hepatitis which is occurring within a short period of time. When we say short period of time, it means within less than 10 to 15 days. So patient will typically come to you with the classical features of hepatitis, which is the icterus, the jaundice, and loss of appetite, fever, etc. And the history would be very short-lived, less than 10 days, 15 days. And that is the acute onset. Before that, patient would say that they would be perfectly fine. And most of the time, these patients, if they do not have any under chronic immune disturbance, then they are able to, their immune system is able to completely eradicate the virus, and they recover completely. And the time period is up to about 3 to 6 months. Okay. And by that time, when you do their markers, and we will talk about the markers later, you will find that they have completely cleared the virus and they have recovered. So that is called as acute hepatitis. However, unfortunately, some patients, they may not be able to clear their virus within the 6 months time. And that is the time when you are monitoring them on sequential basis. And if you see that even after 6 months time, their B surface antigen is not going down and antibodies are not coming up, that is the time when you will label them as someone who is passing into chronic hepatitis. Now, this is a pie chart which is showing you, and I want you to keep this in mind, because this we will use again to compare it with hepatitis C when we will be talking about it. This pie chart is telling you, based on the various studies, that by and large 90% of the patient, if they get the disease in adulthood, and if they are not immunocompromised, 90% of them are able to clear the virus, and only 10% of them unfortunately go into chronicity. Now this actually reverses in case of hepatitis C, and you'll see when we discuss that. Okay, so what kind of a virus is this hepatitis B virus? It is an hep adenovirus. A little bit about virology now. It is, as you all know, viruses are broadly classified as DNA viruses and RNA viruses. And this particular virus is a DNA virus, okay? And its name is hep adenovirus. In the DNA virus, the nucleus of this virus primarily it is double-stranded. It is relaxed and round, and it has up to about 3,200 base pairs. Okay, so it's quite a small virus. This is the structure of the virus. Generally, any virus, if you look at them, structurally they have a genome, which is the innermost part, and then you have a proteinaceous covering, which covers on an outer surface, and then you have outermost layer, which is called the envelope. In this virus, the innermost black thing is the rounded DNA of the virus, and it carries its own DNA polymerase enzyme. This is very, very important. Virus can use host enzymes for its other proliferation, but for its replication, it needs its type-specific enzyme, and that is DNA polymerase. Immediately outside, you see these rounded structures. These are capsid proteins or the core proteins, which you also will see when we will talk about the markers. This is the core protein, okay? This is a high molecular weight protein and usually remains attached within the virus and does not come out into circulation. The green structure at the outermost level, this is the envelope structure or the surface antigen, which we also call as HPS antigen. This is the antigen which is actively secreted and is a marker of acute infection, as we will discuss in a bit. There are different genotypes of hepatitis B virus, and you can see that different genotypes are prevalent in different geographical locations. You don't really have to remember this, but just for your information. There's a video, but I will keep the video towards the end in the best interest of time to show you how the virus enters into the body and how it replicates and multiplies. So we can keep that towards the end so that you can see it at your leisure. But what it is going to show you, I am just discussing it over here. So virus has its specific receptors onto the hepatic cells. These are the sodium taurocolate co-transporting polypeptide. And you can understand very well with its name that it is the same receptor which is used for transmission of the bile salts inside the hepatic cells. Therefore, the reason why these viruses are primarily have the tropism for hepatic cells, okay? Once it enters into the cell, the virus uncoats, which means that the outermost coating has to be removed in the cytoplasm. And then the DNA, because it is a DNA virus, it goes into the nucleus. Within the nucleus, the DNA of this virus converts into a more rounded structure, which is called as covalently closed circular DNA. Okay, when it is in the virus, it is slightly loose, but once it enters into the human DNA, it becomes completely closed and then acts as a nucleus-like material which is independent of the human DNA itself and replicates